Assalamu alaikum. So in this video, we'll be covering the neurosurgical anatomy of the trigeminal nerve. This is a series of videos that will go through the Rhoton collection of the neurosurgical anatomy. Make sure to check the previous videos where we discussed all the cranial nerves from the olfactory. And then this video will talk about the trigeminal nerve. So let's start with this dissection picture, looking at the medial side of the brainstem, or looking at the brainstem, where you can see the trigeminal nerve is highlighted in yellow, and it emerges from the lateral aspect of the pons. The pain and temperature fibers are coming from the spinal trigeminal tract of the trigeminal nerve. And then we have the rest of the lower cranial nerves. We can see the facial nerve, can see the vestibulocochlear nerve, and the abducens nerve. And all of those three nerves are coming from the pontomedullary sulcus. Mentioning that those cranial nerves coming from this sulcus, the pontomedullary sulcus, but actually the trigeminal nerve is the only one that comes and emerges from the pons. Then if we look here at the cisternal segment of the trigeminal nerve. So the trigeminal nerve, as it comes from the lateral aspect of the pons, here is the pons, and it travels in this subarachnoid space towards the petrous avex. Where it's going is going towards the entry or the ostium of the Meckel's cave, where it's here. This is the ostium for the or the entry to Meckel's cave. And what we can see is laterally, that's lateral to the trochlear nerve. So the trochlear nerve is more medial as it's going into the cavernous sinus. If you are not following in terms of the anatomy of this area, you can watch the previous videos where we covered all the anatomy around the trochlear and oculomotor nerve and this area of the dural folds around it and the cavernous sinus and all the surrounding structures. In this one, we're looking at the relationship between the trigeminal nerve root and the arterial relationships. Those are important in the setting of trigeminal pain and trigeminal neuralgia patients, so that you understand the relationship with the other arteries and what needs to be immobilized. So here we're looking at the trigeminal nerve is often most compressed by which artery is the superior cerebellar artery, as you can see. Then you can see also the basilar and the ICA, or the anterior inferior cerebellar artery. They can cause compression, but not frequent. The most common is the superior cerebellar artery. Looking at this picture, we can see more. This is the higher up here, the superior cerebellar artery, and it's in relationship with the trigeminal root, which can cause trigeminal neuralgia. Where you can see the ICA is more common to cause facial nerve compression, which can lead to the hemifacial spasm. Again, this is a posterior view. You can see the posterior circulation. What's highlighted here is the superior cerebellar artery, and it's coming close to the entry zone of the trigeminal nerve. This view, we can see, again, still we're talking about this arterial relationships. So you can see the trigeminal nerve highlighted here, and you can see there is a loop of the superior cerebellar artery is coming down, is causing pressure or in touch with the trigeminal nerve. This is the caudal trunk is in touch, while the rostral trunk is not in touch with the nerve. And then you can see the oculomotor nerve, and this one is the trochlear nerve as it's traveling closely in a relationship with the superior cerebellar artery and going all the way anteriorly, where it goes into this dural ring to enter into the orbit. Here we're looking at the venous relationship. Here you can see the trigeminal nerve, and this is covered or usually obscured with the superior petrosal vein. The superior petrosal vein, they call it Dandy's vein, which then drains into the superior petrosal sinus highlighted in blue here. And this is the superior cerebellar artery. If you're going to cut through the superior petrosal vein to get access to the trigeminal nerve, you have to be careful not to injure the superior cerebellar artery. Here, this is the view that you see in a retroseg approach doing MVD, microvascular decompression for the trigeminal nerve in case of trigeminal neuralgia. and you can see the trigeminal nerve here is covered by the petrosal vein. This is a petrosal approach, and the trigeminal nerve is seen from a right petrosal approach. You can see the motor, that's the motor part of the trigeminal nerve, and superior and medial to the larger sensory root. Here is a picture that we have seen before in a previous dissection with the oculomotor and trochlear nerves, but it's a subtemporal approach, and we are pulling the temporal lobe superiorly, pushing it up, and the tentorium is being incised. You can see the trochlear nerve is exposed along all of its pathway, but if we look here, you can see the trigeminal nerve, which is not easily visualized in this approach. To view that, we will remove some parts. So you have to remove the anterior petrosectomy through Kawase approach, and then you can see better exposure of the trigeminal nerve within the cisternal segment and in the middle fossa. Then here we will look into the entry of the trigeminal nerve after it passes anteriorly as it goes into the Meckel's cave. Here you can see on this picture the dura is still there, and on this one the dura have been removed. Again, we discussed similar picture with the trochlear and oculomotor nerves, but here we can see the trigeminal nerve as it's just approaching beneath the superior petrosal sinus before it enters into the Meckel's cave, which is highlighted here. You can see the motor root, which is smaller, and the sensory root, which is bigger. The motor root travels medial to the sensory root. If you look here into this lateral view, as it goes again, we can see the trigeminal nerve as it goes into the Meckel's cave. And again, you can see the superior petrosal sinus, and that lies medial to the dura of the middle fossa. Yeah, so that's the Meckel's cave is medial to that. And again, you can see the trochlear nerve and the oculomotor nerve higher up. Then here we are removing the dura. So we remove the dura of the middle fossa so that we can see what's happening inside this Meckel's cave. So that's exposed, the Meckel's cave highlighted in yellow. And then you can see the trigeminal nerve as it enters into the Meckel's cave and the superior petrosal sinus. And that's the Meckel's cave again, which is pounded superiorly by the cavernous sinus. So cavernous sinus, Meckel's cave, below it, superior petrosal sinus, and the trigeminal nerve as it enters into the ostium of the cave. Here we can see again on the Meckel's cave, but we divided the superior petrosal sinus so that we can see the whole of the trigeminal nerve. So that's cut, the superior petrosal sinus is cut. You can see the trigeminal nerve here going into the Meckel's cave, and it's going into the trigeminal ganglion. Then the divisions of the trigeminal nerve in this picture, which is lovely. So you can see Meckel's cave is opened up. You can see the trigeminal nerve, and then it fans into kind of plexiform shape into the trigeminal ganglion. And then it gives the ophthalmic nerve, which travels through the cavernous sinus and then exits through the superior orbital fissure. Then we can see the second one, which is the maxillary nerve, as it exits through the foramen rotundum. And then the last one, which is the mandibular nerve, which exits through the foramen ovale, and we can see the foramen spinosum, where you can see the middle meningeal artery. Then we have the greater or the great superficial petrosal nerve, which basically marks the location of the petrous part of the internal carotid artery. So great superficial petrosal nerve and the petrous part of the internal carotid artery, which appears behind the trigeminal ganglion and the V3 as it goes anteriorly. Here we are kind of moving the sensory part of the trigeminal nerve so that we can see the more medially located the motor division. So the motor part, as you can see highlighted, as it passes medial to the sensory root and it exits through the foramen ovale with the mandibular nerve. So the mandibular nerve would have the the foraminal valley will have the mandibular nerve and the motor root of the trigeminal nerve. In this picture, we can see again the trigeminal nerve with the branches dividing into all the branches. The first one is the ophthalmic nerve, as it goes, as we said, through the cavernous sinus, then passes through the superior orbital fissure before it goes into the orbit. Then we have the maxillary nerve, which goes through inferior to the cavernous sinus and then passing through the foramen rotundum, which is highlighted in green. And then it enters into the pterygopalatine fossa, which we'll explain later on. And then the third division, which is the mandibular nerve, which passes through the foraminal valley and then into the infratemporal fossa. So again, ophthalmic nerve will goes into the orbit through the cavernous sinus, superior orbital fissure, and then into the orbit. Then we have the maxillary, goes through inferior to the cavernous sinus before going through the foramen rotundum and then into the pterygopalatine fossa, and then the last one, the mandibular foramen ovale, and then the infratemporal fossa. We will have two triangles made in relationship of those branches. So we have the anteromedial triangle, which is formed by the angle between the ophthalmic and maxillary nerve, while the anterolateral triangle is formed between the maxillary nerve and the mandibular nerve. Then what's the relationship between the trigeminal nerve and the carotid artery? In this, where as we remove the petrous apex, you can see the trigeminal nerve and the internal carotid artery is medial to it. Here, let's look at the bony anatomy and the nerves and the foramina. So the maxillary nerve exits through the foramen rotundum, highlighted in green here. And then we have the mandibular nerve as it exits through the foramen ovale, which lies anteromedial to the foramen spinosum, which includes the middle meningeal artery, and lateral to the petrous apex. Then this is a sphenoid bone foramina, relationship of those foramina to the sphenoid bone. So ophthalmic nerve will pass through the superior orbital fissure, highlighted in green, to enter the orbit, and then the maxillary nerve will go through the foramen rotundum and then to go into the pterygopalatine fossa, which is bounded posteriorly by the pterygoid process. Behind the pterygoid process, we can see the mandibular nerve will be passing through the foramen ovale to enter the infratemporal fossa. So it's covered here, but you can see it will go through the foramen ovale to the infratemporal fossa. So in this one, we're looking at the pterygopalatine fossa and the infratemporal fossa, and that's a coronal section just at the orbital apex. So we're cutting through, and let's see. So we can see here, after it passes the foramen rotundum, you can see the maxillary nerve is entering into the pterygopalatine fossa, and that's medial to the infratemporal fossa. Then there are some little nerves like the Vedian nerve, which is really difficult to see, but it enters the pterygopalatine fossa through the Vedian canal. Then it terminates into the pterygopalatine ganglion, which is again a little structure here, which also communicates with the maxillary nerve. And then we have the greater palatine nerve and descending palatine artery, which can be seen also in this pterygopalatine space or fossa. And then we have the mandibular nerve, which goes into the infratemporal fossa through the foramen ovale and then branches out. In this picture, we have seen this dissection before. It's again superior view of the orbit with the other fossa, the infratemporal fossa and the pterygopalatine. So we can see the ophthalmic nerve entering into the orbit through the superior orbital fissure. As it enters into the orbit, it courses superior to the oculomotor nerve and optic nerves. The ophthalmic nerve will branch out to give the lacrimal nerve, nasociliary nerve, and frontal nerves. The frontal nerve as well can branch into, or will branch into supraorbital, supratrochlear nerves. We have the nasociliary, it branches into long ciliary, anterior ethmoidal, and infratrochlear nerves. Those are all the branches of the ophthalmic nerve. And then we have the maxillary nerve as it goes into the pterygopalatine fossa, as explained in the previous dissection, and it divides into multiple branches. And then we have the mandibular nerve here as it goes into the infratemporal fossa and it gives its multiple branches again. This is a kind of endoscopic view from the cavernous sinus. So you can see the ophthalmic nerve is seen in the cavernous sinus. This is the cavernous sinus, and that's below the oculomotor nerve, superior and lateral to the abducens nerve, and lateral to the cavernous carotid, internal carotid artery. You can see the maxillary nerve as it exiting the foramen rotundum. Here you can see the infraorbital. To look at the infraorbital nerve, so the maxillary nerve here is entering the pterygopalatine fossa. So maxillary nerve going into the pterygopalatine fossa and the branches. It passes through the inferior orbital fissure and continue as the infraorbital nerve. So through the inferior orbital fissure to form the infraorbital nerve in the infraorbital canal, which basically in the floor of the orbit. That's the orbit, and that's above the maxillary sinus. So orbit, maxillary sinus, infraorbital canal, and infraorbital nerve, which is a continuation of the maxillary nerve. Then we have the mandibular nerve, which branches into the infratemporal fossa. Please don't forget to subscribe and like those videos so the content can be seen by other people, and let us know in the comments below if you want to see specific videos covered in our channel.